get started. Today's presentation is going to be about how we as professionals working in the aging field or as community members can support LGBTQ and HIV positive older adults. And this is in celebration of June. Let's see if I can advance the slides. Okay. So what is HIV? HIV is a virus that attacks the body's immune system, specifically the CD4 cells or T cells, which help the body fight infection. If untreated, HIV can lead to AIDS and can be very serious, oftentimes leading to death untreated. So the people who have HIV are most predominantly men who have sex with men from receiving infection from unprotected sex. But people with HIV also include heterosexuals who are infected with HIV from a romantic partner. Spread of HIV also happens through sharing needles, infection from blood products, and can also be transmitted from a mother to fetus. So many people are born with HIV. HIV does disproportionately affect people of color, especially heterosexual women or who are people of color are disproportionately affected in that population. And yes. So in New York City, there are over 108,000 people living with HIV as of 2021. This map is 2021 HIV surveillance annual report and shows the areas in New York City that are most affected by HIV. Many of the areas with the highest prevalence are served by Presbyterian Senior Services, underscoring the importance of targeted support for older adults with HIV. So my position, New York Connects, we cover Brooklyn, which we can see Brooklyn is significantly affected. And then also, many of our centers are in Uptown Manhattan and the Bronx, which have higher prevalence of HIV. Additionally, as of 2021, 57% of New Yorkers living with HIV are over 50, showing that the treatments that we have are effective, leading to longer life expectancy, but also the need for age-appropriate care. Also, as we age, we experience more health challenges, also social challenges, many different types of instability. And so as the aging population grows and the HIV aging population grows, it's going to continue to be important that aging professionals have resources available and understand the network of resources to connect community members with the services that they need. And then additionally, many people living with HIV in New York City were born outside of the United States, showing that we need to have good language access to help people from diverse backgrounds. Additionally, stigma, both around HIV and immigration status, can discourage people from seeking testing, treatment, or support. This fear is especially strong in communities where disclosure could lead to isolation or legal risk. And we are really experiencing that now with many of the political changes happening. In the early days of the AIDS crisis, government inaction and medical neglect left thousands of New Yorkers, especially gay men, trans women, and people of color, without answers of care. In response, activists in New York City organized, protested, and demanded change. Groups like ACT UP, GMHC, and Housing Works pushed the city and federal government to invest in HIV research, expand access to treatment, and recognize the rights and dignity of people living with HIV and AIDS. Because of this advocacy, New York City has become a national leader in HIV care, prevention, and housing support, proving that when marginalized communities fight for their lives, they can reshape public health. And for many people, engagement in advocacy or organizations helped improve their isolation and life outlook. These organizations became family and really has led to their long-term success. And to me, this brings up the concept of healing justice, which was launched by the Kindred Southern Healing Justice Collective in 2006, thinking about how participation and advocacy can be used to alleviate many of the challenges that people face, things like social isolation, and providing a sense of direction and purpose. And because of this advocacy, we now have medications that can successfully treat and prevent HIV. We have, people with HIV take antiviral medications that eventually bring them down to undetectable. And so undetectable means untransmissible, either through unprotected sex or through intravenous drug use. We also have PrEP, which can significantly reduce the risk of transmission of HIV through intercourse or intravenous drug use. And more recently, we have PEP, or post-exposure prophylaxis, which can be used to cure HIV if someone tests positive in a window of time after infection. And so we now are lucky to have really amazing treatment options, and especially in New York, later on we'll discuss how there's really several medical providers that provide these services. But people with HIV, and especially older adults, face significant challenges. HIV and HIV-positive older adults experience disproportionately poor health outcomes due to stigma, discrimination, and lack of affirming care. They experience disproportionate rates of heart disease, arthritis, cognitive decline, and depression. This is possibly due to how HIV creates inflammation in the body, and which can lead to accelerated aging. The increased inflammation can lead to higher risk of infection, but also other non-communicable diseases like diabetes and cardiovascular conditions. And now there is emerging research into a condition called HAND, or HIV-associated neurocognitive disorder, which I describe here. The pathology of HAND remains incompletely understood due to its complexity and highly variable presentation. But we're beginning to see that people who have had or who are long-term survivors of HIV might experience cognitive decline, mobility challenges in combination with other health conditions. People who are LGBTQ or HIV older adults are also significantly higher risk of social isolation. Nearly 50% live at home compared to 33% of all older adults. There's also research into a phenomena called AIDS survivor syndrome, which it was coined by an activist named Tez Anderson and describes the poorly overall managed health of long-term survivors, which can lead to many comorbidities. Many long-term survivors lived through a time where they expected to die, and many of their friends have passed away. So it can be a combination of survivor's guilt, social isolation, and other systemic challenges like economic insecurity, housing insecurity, and political violence. There are also significant barriers to accessing affirming care. Many LGBTQ plus elders report fear of mistreatment in medical or long-term care settings. And HIV positive elders face fragmented care, limited support for their many co-occurring conditions. And many healthcare and social services providers lack training on LGBTQ cultural competence. And then let's keep going. So I have created a resource guide designed to connect LGBTQ and HIV positive older adults with the services that they need. This includes areas of housing, healthcare, advocacy, right? Because through participation in advocacy, it can really help to address many of the challenges that older HIV positive people experience, and community centers. Whether you are a service provider, a caregiver, or a community member, this guide is meant to be a practical tool, something you can use to make a referral, answer a question, or help someone feel seen. I also hope that this supports long-term connections and more equitable aging. And so why should PSS and the greater community be equipped to serve HIV-positive seniors? Just to reiterate, it's because 57% of people living with HIV in New York are over age 50, and they live in the areas that we serve. Also, because PSS stands for inclusion. We recognize that LGBTQ and HIV-positive seniors bring strength, history, and resilience, but are often overlooked. Also, our mission demands it. We are here to strengthen the capacity of older New Yorkers. And that means meeting people where they are with affirming care, informed staff, and programs that reflect lived experience. And also, we have the opportunity to lead. With trusted senior centers, caregiver support, and access to housing services, PSS is uniquely positioned to build safe and inclusive spaces for those who are often left out of the conversation. And so these are the sources, and then I'll go back to a nice slide and we can have a discussion. And then I can also show the resource guide that I created. So should I maybe show the resource guide first before having discussion?
You could do that. And
Okay.
just to note that the resource guide is available on the PSS Life University page. So it's already there. You can look at it afterwards as well as see it now as we talk.
Great. Okay, so I'll pull it up. Okay. Let's see if I can find it. There it is. All right, can you see my screen? Yes. Okay. So, so I start with healthcare, discussing really prominent providers, including Callan Lord, who has locations in Chelsea, Bronx, and Brooklyn, Montefiore, which has a center in the Bronx, and then also AHF. AHF has locations in Brooklyn, Harlem, and the Bronx, and they also serve people who are uninsured. There's also Housing Works, who provides testing and harm reduction, including uninsured people. The Community Healthcare Network, APICHA, Mount Sinai, and then New York City Health and Hospitals also has several Pride Health Center locations across the city. And then, so I also have a list of community centers focused at HIV and LGBTQ people, and I've highlighted the programs or centers that are focused at older adults. And then, so last I have discussion of housing resources. So there's the HASA program, which is by HRA, which provides housing vouchers for people who are HIV positive. And there's also senior housing developments by SAGE. And I also shared organizations that can provide assistance with housing. And also opportunities to engage in advocacy, including ACT UP, the Audre Lorde Project, and Destination Tomorrow. And does anyone have any questions or comments?
Yes, please put
Or
comments in
you're
the
welcome to
chat.
put them in the chat. Are they allowed to unmute themselves?
Yeah, they can unmute themselves but I can get us started. So surprising numbers there, Madeline, that 57% of HIV positive people are already older than 50. Is this an aging population then in total?
Yeah, so I would say that our population is aging as a whole, but especially people with HIV, because rates of transmission are significantly reduced due to successful viral suppression and use of PrEP. in high-risk communities. So people who are men who have sex with men, sex workers, or who use intravenous drugs. And we also are seeing like that people who are older adults are still becoming newly affected. I think it says 15% of people newly affected by HIV are older adults. So that can also be due to a risk of safer sex practices or lack of knowledge or stigma around safer sex practices.
Okay, very good. Interesting. I see we have a comment there thanking you, saying it's great information, very much needed.
Thank you. Thank you,
Madeline,
Desiree.
you talked about a lot of problems that HIV positive people have. Is there one that's larger than all the others, or is it even possible to look at it that way?
I would say that it's really the main takeaway is that there's a broad like there's a broad web of challenges facing people who are older adults with HIV. I would say the most significant are comorbidities of health conditions. People might have lived with HIV for several decades, but are now facing health conditions that are non-communicable, possibly due to the chronic uh, the chronic inflammation as a result of HIV. But also we don't have good research yet, or we're beginning to have better research about the effect of the antiviral medications on one's body, right? The risks of taking them are known to be low in the short term, but in the long term, we don't yet know, what the long-term effects are going to be. But I can say that in my experience, I do, I have worked with people who are HIV and older adults, and it is definitely their main challenge is oftentimes managing their multiple health conditions. Milagros says, I agree, this information is very much needed. Sometimes we forget about our older adults that might be active too. That's true. STDs are becoming an increasing problem in long-term care facilities and with older adults. And also, I think many of our senior centers are in New York City housing developments. And so many people who have been diagnosed with HIV for a long time hold HACA vouchers, meaning that they might be oftentimes living in the developments that we serve.
Madeline, you said that there's a high proportion of HIV positive adults who live with their families. Do you mean their families of origin?
Oh, I don't think I said that they're much people, older adults with HIV are much more likely to live alone and to not have contact with their
Alone, I'm
family.
sorry, I misheard,
Yeah.
misheard that.
But so a common kind of theme is that many people who either have HIV or know people who do played roles of caregivers during the beginning of the epidemic. And so many, oftentimes as they age or as they become caregivers again in their lifetime, um, it can bring up a lot of difficult, challenging feelings or memories because of the trauma that happened during the beginning of the epidemic. Um, so there's definitely a common theme of caregiving, whether it's of formal, of biological family or of found family.
Wow, that's really something. And you talked about social isolation. I know that's a problem in the older adult population overall, but it sounds like it's even more so with this group.
Yeah, I would say that it is more of a greater issue. It's an issue, for older adults across the board. But people with HIV, really, older adults really do experience social isolation at high rates. This could be due to rejection from family or social systems that they were part of when they were younger. Or it could be due to cognitive challenges, mental health challenges that could be related to HIV or its treatment. And so Jonathan Henriquez says, I agree. Being comfortable speaking up when talking with others or their potential partner and understanding different suppressant medications for people. Yes, that's absolutely true. So when people take these antiviral medications who are HIV positive, after some time, they can be successfully undetectable on a test and having incredibly low rates of transmission. Additionally, PrEP can significantly reduce, I think it's not 100%, but it's very, very high, the risk of transmitting HIV, but PrEP does not protect against other STDs. So it's still important to practice safer sex practices.
Well, thank you very much, Madeline. We
You're
really
welcome.
appreciate not only this presentation, but what you and your colleagues at PSS, at all the different branches of PSS with the different social workers do in supporting the older adult community in all its facets, and particularly this facet, which is often overlooked.